Today, the full committee is meeting for our second fully virtual markup to consider 38 pieces of legislation as our nation continues to suffer from the devastating impacts of the COVID-19 pandemic. This committee continues its work to provide real relief to the American people. During today's markup, we will be considering 3 communications and technology bills. One bill, the Bipartisan Phone Act, ensures that phone providers don't give away residents' phone numbers when the houses are destroyed in the wake of a natural disaster like a wildfire. We will also consider 2 bills addressing diversity in the broadcast industry. We'll consider Representative Butterfield's bill that would create a tax incentive for big broadcast stations to sell their stations to women and minority owners. We'll also consider Vice Chair Clark's bill that requires broadcasters and cable companies to once again file equal employment opportunity data with the FCC. We'll also consider today 26 healthcare bills that will expand access to mental health services, combat the opioid epidemic, reauthorize key public health programs, and improve Medicare enrollment. And I'd like to mention just a couple of them. First, the Ensuring Lasting Smiles Act, which requires all health plans to cover medically necessary treatment resulting from congenital anomalies or birth defects that affect the way kids look, develop, or function, often for the rest of their lives. Then we have H.R. 945, a bipartisan bill that would improve access to mental health providers in the Medicare program by covering mental health, counselor, and marriage and family therapist services. And as our nation continues to confront the COVID pandemic, nearly half of all Americans are reporting that their mental health has been negatively impacted due to worry and stress. Substance use and overdoses also appear to be on the rise. And to help address these issues, we're considering legislation to help support patients with substance use disorder and their families, help address mental and behavioral health for students, and provide mental health supports for healthcare providers in the emergency departments. I'm also pleased that we're moving legislation today that will facilitate further research access to marijuana, as well as legislation to help address public health data sharing for our tribes, which have been, as you know, disproportionately impacted by COVID-19. We'll also consider legislation to protect consumers from the flood of unsafe products entering our country from overseas. We'll consider bills that modernize our consumer protection agencies, reduce fraud and scams, and help us better understand the effects of the COVID pandemic on home safety and tourism. And we'll also consider legislation meant to protect the health and safety of racehorses and jockeys. And finally, we'll consider 2 bipartisan energy bills that will expand access to sustainable energy and reform the Department of Energy's management and personnel practices. I'm not mentioning everything because many of the bills, are not really controversial at all. I thank both the members and the committee staff for all the work to get these bills to a place today where we can advance them to the House floor with strong bipartisan support. And I encourage my colleagues to support all 38 of these bills today. Now, again, as I said, the idea is to move these to the floor. We're going to be in session for 3 weeks in person, other than by proxy, after this week. And the idea would be to try to move all these to the floor. I'm not saying that necessarily that's going to happen, but that is what we're going to try to do.